Hello and welcome. We'll just give attendees a few moments to get on, and we'll be starting the seminar shortly. All right. Well, welcome. Good morning or afternoon, and thank you for attending today's seminar on using data and informatics in environmental public health. My name is Nicole Dutra Marquez. I'm a senior project coordinator for the National Environmental Health Association, and I will be monitoring the seminar today. The agenda for today's seminar includes a quick overview of who is NEHA, where I will provide some insight to our organization and our role in environmental public health. Next, I will introduce our guest speaker, an expert who will speak to you on using data and informatics in environmental public health. Following the presentation, we will move into our panel discussion with 3 environmental health professionals who will share their experiences working in the field. Lastly, I will share with you information on NEHA's 86th Annual Education Conference. Allow me to cover a few housekeeping items before we get started. Please note that this webinar is being recorded. The webinar recording will be uploaded onto the NEHA website at www.neha.org. We will take a few questions upon completion of our guest speaker's presentation and during the later panel discussion. So please feel free to drop your questions in the Q&A box at the bottom of your screen. At the conclusion of the seminar, you will receive a link to take part in an evaluation where you'll be able to provide us feedback and comments on today's seminar. With that, let us begin today's seminar. Before we talk about who we are, I wanted to take a moment to talk about our profession. While many don't recognize it, environmental health is the foundation of public health. As you can see from the World Health Organization, nearly a quarter of deaths around the world are due to a health risk in the environment. Environmental health refers to protecting humans from health risks that come from the environment, such as pollution in the air, contamination of food at a restaurant, or lead in a water source. Environmental health is also one of the 3 legs in disease outbreak. It takes all 3 professions to prevent and reduce outbreaks to protect public health. As an association, everything we do is to build, sustain, and empower environmental health professionals so that they are equipped and prepared to protect the health of communities across the country. Our most recent membership survey revealed that most of our members are working directly with communities at the local level. The survey also illustrated that our members serve all types of communities from very small to very large. This map illustrates the reach of our fiscal year 2022 projects throughout the country. We supported and partnered with jurisdictions on 768 projects. To support the workforce, we also invest in environmental health via funding from FDA and CDC on topics from food safety to land reuse. In fiscal year 2022, we invested nearly $10 million. Some examples of these are investments included support for jurisdictions participating in the NEHA FDA Retail Flexible Funding Model Grant for food security, scholarships for the Leadership Institute, funding for tribal entities and U.S. territories building their environmental health infrastructure, specifically around childhood lead exposure, disaster relief, and vector control issues, and also mini grants for health in all policies. Part of how we support public health overall and environmental public health specifically is by continuously providing training and education and offering credentials to certify the expertise of our workforce. In addition to our large online library of courses, webinar recordings, and resources, we host an educational conference every year that includes 14 different tracks, from leadership to emergency response to body art to communication. This year will be in New Orleans. We have a team of instructional designers who build online and in-person trainings and instructors who deliver courses to provide the latest in research and practice to our workforce. We also provide field training in the Pacific Islands. We offer 6 credentials that certify expertise of all facets of environmental health, as well as specific aspects of food safety practice. We advocate for funding and policy at the federal level for the environmental public health profession specifically and public health generally. We also provide our members with regular updates on relevant national and state legislation through our webinars and blogs. We believe that part of building and sustaining our workforce is to provide opportunities for professional growth at many levels. We offer scholarships and internships to students studying environmental health sciences and the first ever Environmental Health Leadership Academy for professionals already working in the field. Much of our work is connecting the right people together and serving as the lead or support to set and meet goals that serve the profession and environmental public health. A few of our communities include the Private Water Network, Climate and Health Community, Concurrent Disasters Community of Practice, and Environmental Health Strike Team Standard Community of Practice. For our members, we provide an online social platform we call Community. It allows members to connect with each other, ask questions, and get tips. On the platform, we offer events like a quarterly 30-minute leadership presentation called Spark, and we're just launching an Ask the Author pilot for members to ask questions and hear more from a featured author in our Journal of Environmental Health. We welcome anyone who would benefit from the research, education, advocacy, and connection we provide for the environmental public health community. You can learn more about all that we do on our website at neha.org. Now let's get to our topic on using data and informatics in environmental public health. Our guest speaker today is Tim Callahan. Tim has worked over 30 years in various roles in environmental health, including 7 years in the U.S. Army, some time in industrial hygiene in the private sector, and 12 years as a county environmental health specialist. Since 2007, he has been developing, implementing, and managing a statewide environmental health data system to support daily field operations and improve general policy decisions. He completed his fellowship in the CDC's Environmental Public Health Leadership Institute in 2009 and earned his master's in public health from Augusta University. So Tim, we are all set and ready to go. Just a quick reminder for everyone attending, please drop any questions that you may have for Mr. Callahan in the Q&A box at the bottom of your screen. Thank you. Go ahead, Tim.
Greetings, everyone. I'm glad to be able to be part of this unique opportunity to be able to share what environmental health is doing across the nation with data. And as stated, I'm Tim Callahan. I work for the Georgia Department of Public Health and Environmental Health section, and I'm lucky enough to have a role where I get to play with data every day. The first thing I'm going to do is just cover a brief agenda. We're going to introduce some of the data uses and some of the current situation with data and environmental health here in the U.S. Then we're going to cover a couple of uses in detail within Georgia, as well as how you could use the data yourself. There's some challenges, of course, involved with environmental health data use or informatics. And the tools that might be available to you. We'll cover some of those. And this is a very brief introduction of these things, so you have some idea of what you might be able to do with within the field of environmental health and working with informatics. To start with, CDC and other organizations have been funding a data modernization initiative for a couple of years. You can learn about that with the Public Health Informatics Institute, where they have an online toolkit. The link to that is available in the slide deck, which we're hoping to share after this. The multiple jurisdictions and agencies across the states make data compilation rather difficult. There's approximately 2,800 jurisdictions across the U.S. of environmental health and public health. So For example, here in Georgia, we have 159 counties. And then you have some different structures of there. We'll get into some of that later. But environmental health in general is a little late to the data modernization initiative, and as it was not necessarily a core function of the pandemic response, as much as immunization and epidemiology were, environmental health wasn't necessarily a huge part of the DMI, or data modernization initiative, effort and funding. Add to this that there's not terribly many systems across the U.S., environmental health systems, that are using databases. About 1,500 of them, of the 2,800, are actually publishing just food service inspection data to make it available. That's according to Hazel Analytics. And also the workloads and such make it so that most environmental health specialists are not tasked with data analysis activities. So they don't really get the opportunity to gain those expertise in that skill level in informatics tools. That complicates things initially, but let's start with what data informatics is, or informatics in general. Now, according to Techipedia, this is a definition of informatics. I won't necessarily read it to you, I'm sure you can, but an alternate definition is it's basically all aspects of the collecting and manipulating, turning data into relevant stories to help make decisions. And a key element that often is missed with the definition of informatics is that we're speaking to the systems that generate and work with data. That includes the people, the politics, the resources available to them, as well as the data itself and the interfaces, and it's everything involved. So it's important to understand that it's more than just grabbing some spreadsheets and putting them together. If you're going to begin with data, obviously you have to have a source. And I didn't begin in this field with informatics or data. I began as an environmental health specialist, jumping ditches and checking temperatures and so forth. But my beginning of this was getting into grabbing the data that was available to try and figure out what's going on so I could shift my own perspective. That expanded substantially to where I took on the role of setting up a data system in Georgia. So this is one example of how some data systems can exist. And to be candid, what we're looking at here, let me back up a slide. We have all of these different pieces that belong to each one of these different fields of environmental health. You have permits, inspections, and plan reviews for food, tourist pool, body art, on-site sewage. We get complaints about animal bites, and we have site evaluation for wells and on-site. All of these things interact with each other to some degree. Your food service will have some concern over whether it's on a well or whether it's on septic tank. You'll have childhood blood tests that have to do with both a child comes up positive for an elevated blood lead, and you get there, you do an environmental assessment of the home, and you find that there's carbon monoxide in the home, and you can work with them on that. So all of these things are interactive with each other, and it's important to understand that this can be relevant when you're doing informatics, in that you have to join these things. You have to be able to make these things intersect. In Georgia, we rolled this thing out. It started out in 2008. We got 156 of the 159 counties in Georgia using one data system for the majority of standard field work. And then in the case of case management and surveillance, we have 159 counties using one surveillance system and case management system for childhood blood lead and for rabies and animal bites control. Any age data system can be huge, though. Now, fair warning, if you do become part of a group that is putting together a data system, consider the fact that environmental health is basically very encompassing of everything there is in the universe, in that anything can be a data point, and all these things can add together and become a very large data system. This makes using data system tools essential as part of the job. Thing is, data is available everywhere. You can combine it with other sources. US Census, of course, can give you demographics and the economics of a community down to the census block level. You have Bureau of Labor Statistics can tell you about workforce and help you address issues to deal with in the environmental health workforce and salaries and so forth. You can get weather data from NASA as well as from NOAA to say you're wanting to assess well impacts or septic tank impacts dealing with precipitation. Causes of death, bouncing back to a variety of things, including asthma and indoor air quality. You got tax records, which will be absolutely essential for your GIS operations to be able to figure out where stuff is, who owns stuff, and whether or not the property has a structure on it or not. All these things become very valuable to you. You have numerous systems that are available and readily accessible to you. The challenge comes to how do you bring this all together? Now, there's a group at the CDC who's been working on it for over 25 years, and that's the National Environmental Public Health Tracking Network. I highly encourage you to do a web search for the tracking network from the CDC and take a look at the data sources they have available. There's numerous maps, charts, and very informative elements there, dashboards and such that can tell you about the community you live in, as well as about other ones that you're interested in. Now we get into a few use cases for, say, your environmental health specialist in a county or a manager of that, or in a city or a district. You can use your inspection data to find a variety of things, such as the risks for foodborne illness before an outbreak happens. You can define the impacts of floods and precipitation for the sake of septic tank repair. An example of this is that you can see that there seems to be a cyclic nature to repairs in the red here, that septic tank repairs over a period of years. You can see when the wet season in Georgia generally is. You can check out the performance of work, such as inspection frequencies, as well as workload and what areas of the jurisdiction might have a excessive workload and help balance that workload across different staff. And of course, financial. And a fair warning that financial is always going to be a key element in environmental health because many of our services are fee-based. So as such, that's going to be a key data element that you'll be working with. And then of course, how does this impact community needs, such as preparing for changes in staffing or changes to population growth to address those things over time. These are just a couple of the impacts. There's numerous others, obviously, but the key here is that you need to understand what is at play and what type of challenges you'll have to overcome in order to bring these things together. The first challenge, and I'll go over that in more detail a little later, is the agency structure as far as who has the authority, such as a public health agency structure is obviously the foundation on which any informatics system is built. You have a variety of shared accountability that if that's missing, you end up with diverse activities and divided data silos that don't get brought together very easily. You also have some lack of data capability to make decisions, which makes it a very reactionary agency, one that responds to outbreaks instead of putting investment into prevention efforts, one that has to be maintained on a path when political shifts or anecdotes drive the resources toward other areas. There's also the fact that fee-based services can often be prioritized because the data is available to say, hey, fees are paying for this service, such as septic permits. But other priority things such as hand washing advocacy or education to communities about protecting their wells may not get any money coming in, so they could be deprioritized. Now, getting into other things is that federal funding usually comes in grants and is great for capital expenses, but is not as well established for establishing a maintenance of the system, keeping it going. So a data system should be viewed as equal to paying the light bill, and that has to have a sustainable funding beyond just the initial investment. Over the last 10 years, environmental health has been chronically understaffed and has caused numerous complications of just trying to get people to take a look at the data, be able to have time to pull it together and interpret it and properly convey the message that they can from it. It also means that the training for these folks can be rather difficult. The turnover across environmental health has been a challenge as well. And of course, data systems are not cheap. If you build it in-house or you contract it out, you're going to have an expense. Either you're going to pay a developer full-time in-house, or you're going to pay for somebody to come build the system for you. How many different fields of environmental health you're going to cover changes the costs. Hardware, it can be seen, as I said, like a light bill. It's going to be an annual expense. And training and staff turnover, you have to accommodate as well. And then, of course, internal system management staff like myself to be able to keep the users happy and make sure that you can keep policy decisions and system decisions well handled within the case of governing the system. I mentioned a minute ago about the diversity of the environmental health operations. In each state, the environmental health regulations are split amongst public health, environmental protection, agriculture, and other agencies. This multiplies the complexity of data sources. For example, in Pennsylvania, food is under Department of Agriculture, but Philadelphia and Pittsburgh have their own local food safety agency. Massachusetts has 351 townships, and each set their standards for environmental health education policies and data. In Georgia, our well permits are not issued. We don't have an authority to issue well permits. It's handled under our Department of Natural Resources and Environmental Protection Division. And that's a Well Standards Act, but environmental health under public health is asked to perform the coliform sampling, water sampling for coliform of these wells on request. Now, you do have a lot of tools available to you, and luckily a number of these are free. And if you want to get into data analysis, dive in, both feet, make time for it. Because like Excel, the online Excel is free. Power BI desktop is free. Tableau online is free. There's numerous free GIS tools like Google Earth and OpenMap. Each of these can get you started in understanding how data is structured, how data can be pulled together. And it's a great way to begin a career. But the challenge here is that you have to make the effort for it. Now, I encourage you that you first find data sources that are interesting to you and a question you want to answer. Try and fail as often as you can because it's the most effective tool, and share what you learn with others. For me, I went to YouTube University. I spent numerous years just plugging through, trying to learn a couple of these tools and go into web search and to various things just to look up where so many people who are so helpful put out free content to help you learn and how to do different things. It's a good thing to explore, and it's a good way to get started. Now, what's next is, of course, this particular web series is targeted toward environmental health professionals who are beginning their career. And I encourage you to consider some of these opportunities for you in the case of being a data analyst within an organization, or even externally as your own business, working as a subject matter expert. With all the free tools and training that abound, it's key, even if you aren't starting a career in data analytics. It's key to learn these things and keep practicing these things and keep up to date with these different tools and the data sources, so that when the leadership opportunity comes open to you, you have the availability, you have the experience, you have the knowledge to, at the very least, be able to critique and to scrutinize the analytics that come to you. the informatics that you're working with. Now, I passionately support the advancing of data storytelling, as you might guess here, in environmental health. The success of the profession requires organizations to focus on these increasing capacity for all levels, from beginning all the way through the top tier executive directors should understand informatics. Some common standards common data standards are very important to promote as well. As you note here, both state and federal opportunities that are in play, such as demonstrated by the Data Modernization Initiative from CDC, is that the advantages of having a standard is that it reduces the cost of just having a system, building one, being able to upgrade it, being able to staff it with people and keep them well trained, be able to identify best practices between different organizations, as well as reduce time from when the data is collected to the time that the data analysis can have an impact, where you can tell the story of what's going on. In summary, you have to know data analysis to some degree in any role in environmental health. It's inevitable. Data standards may be difficult to bring together, and they might be handled by data sharing agreements. They might be handled through a variety of initiatives from the CDC or from other organizations, but they're necessary as well if we're going to get a handle as to what's happening across jurisdictions, because what happens in the environment doesn't limit itself to a jurisdiction. You're delivering good things to your customers. So you're trying to provide evidence and use the data-centered stories to tell what's going on, and to be able to shift the mindsets and to guide the policies that people ask you to pursue. And of course, you're guiding yourself first. Your initial hiring, your ability to increase your position, to be able to pursue leadership in environmental health operations, absolutely depends on your ability to at least scrutinize data and informatics. That covers it for my presentation. And if you want to contact me, feel free to record this information and reach out to me. I'm happy to talk about this stuff, obviously, and leave it out and say, are there any questions?
Great. Thank you for sharing your work and knowledge today, Tim. We'll go ahead with any questions for Mr. Callahan. Please use the Q&A box at the bottom of your screen to drop any questions that you might have. And Marilyn, I saw that you had your hand raised. Are you able to drop a question into the Q&A box? All right, we have a question here for you, Tim. What are some things students should begin working on to be able to build a portfolio?
Well, as I mentioned in the presentation, it's important to get in there and dive into the different tools and data sets that are available, but start with finding out a question that you are curious about. Identify something you want to learn about. And then just simply web searching can get you started to finding out different data sets. Learn about GitHub, learn about Discord even, all these different places that you won't find in your general web search that can get you started with data sets that you're curious about. Say you're curious about on-site wastewater and water recycling. Numerous organizations have published articles that are open source and available that you can get the data sources from and be able to address the questions you're asking and see how they might apply to. You can use a Census Bureau to pull data and look at what are the socioeconomics that might pair up to what the research said, and say, hey, does this impact us here? As you start answering these questions for yourself, you can use that as demonstration of a project or even publishing in the NEHA journal, elements that are relevant to you, as well as can build your portfolio for your leadership roles.
Great, thank you, Tim. Any other questions for Tim Callahan? And so we have one from Charlotte. What was the most impactful project you've been on?
I'll have to say I'm still on it. My leadership project with EFILI, Environmental Health Leadership Institute, CDC ran on, focused on the idea of implementing the environmental health standards, performance standards. This is not just public health or food service. It was the performance standards that were presented by the CDC at the time. And identifying that the lack of assessment of the performance of all the environmental health work was in play because financial data was available, so we focused on it. But that focus drew us away from it, deprioritized acting on complaints. Our investigation time between day a complaint came in and we actually investigated a complaint extended out sometimes months. Not a good thing. So with implementing that and using that as a focus of identifying, okay, where are people successfully pursuing improving preventive measures as opposed to financial outcomes for doing the work, the results are that we shifted from focusing so much and worrying, putting so much workload on, we have to issue a new septic permit, we only have so long to issue it, to, hey, we're going to have to delay that a little bit because we have this other issue we have to address. It's a preventive measure. We know that we have wells that 25% of the samples are coming up positive for coliform each time we get a requested sample. It's a problem. We know it's there. We message that out. We have other things that we address as well. We reduced our complaint response rate from very long down to less than 3 days on average for numerous quarters. So it's been very helpful to advance that.
Great, thank you, Tim. Any other questions for Tim? All right, well, thank you so much, Mr. Callahan, for your participation and your presentation today. That was wonderful. Now we'll move on to our panel discussion with Carla Shoup, Dr. Iyab Mazangia, and Serene Ong. Carla Shoup is the Environmental Health Manager for Southern Nevada Health District's Consumer Health Section, which consists of an aquatic health plan review and operations teams, a plan review for food, childcare, institutions, and body art, and the operations teams manage the inspections for childcare, institutions, and body art. Ms. Shoup is a Las Vegas native who earned her Bachelor's of Science in Zoology at the University of Washington and her Master's in Public Health from the University of Nevada, Reno. Over the course of her professional career, she has enjoyed working in physician offices, managed care, and public health in various capacities. She has worked at Southern Nevada Health District for 16 years, with 10 years in leadership positions. Dr. Iyab Mazangia is a public health scientist with specialty in environmental public health. He currently works as an assistant division director of environmental public health services with Public Health Seattle and King County, and an assistant affiliate professor at the University of Washington School of Public Health. He teaches, mentors, and develops future public health leaders. His focus of work includes food and water microbiology, laboratory method development, epidemiology of foodborne outbreaks, monitoring and evaluation of regulatory programs, food safety audits and research, evaluation of regulatory programs, quality and analysis and quality control of staff trainings and inspection services, data analysis, and the development of performance measures. His passion is to generate and use data to inform decision-making to improve food safety inspection services. Serene Ong is a GIS analyst with over 20 years of applied GIS experience in wildlife conservation, natural resources, economics, and public health. Currently working at San Bernardino County's Department of Public Health, she specializes in spatial data analysis, mapping solutions, data visualizations, and mobile field data collection applications. As a data analyst, her role is to transform complex data and present it in an accessible format to inform public health policy and response. Her diverse project portfolio includes COVID-19 and other health concern mapping, surveillance, and dashboard reporting, identifying and locating at-risk populations for targeted health services and education, showcasing key metrics through dashboards and maps. Environmental health services projects such as facility and permit lookup map applications, inspection district creation, map-based assignment dispatch applications, field inspection data collection mobile apps, performance and productivity dashboards, and emergency response mapping. Serene's goal is to use geospatial technology to advance health equity and improve the delivery of health services across the country. Now we will begin with the panel discussion, and as a reminder, please put your questions into the Q&A box and we will attend to them. All right. So, Dr. Mazingia, how do you use environmental health data in your everyday work?
Thank you, Nicole. As someone who manages food safety and water recreational programs for public health Seattle in King County, my responsibilities are very extensive. Regularly reviewing our data, I identify gaps in the data we collect. I ensure we have a working system to capture and retrieve the data of interest. I want to make sure that staff are trained in the collection, data entry, and retrieval of the data. And I want to make sure that we are telling our story using data. That includes interpreting the data that we have. Work with our continuous improvement team and IT teams to develop dashboards, reports to visualize the data for internal and external use. And lastly, and the most important, I think one of the most important aspect of my work includes work with a third-party data users. That includes various academias and private entities to make sure our data is available and useful. Thank you.
Thank you, Dr. Mazingia. Carla Shoup, how do you use environmental health data in your everyday work? Carla, you're on mute. Sorry.
So sorry about that. Thank you. Let's see. So as a public health manager, I'm obviously using data to check staff productivity on a regular basis, but we also use the data to support public health outreach activities. So one thing we did in our aquatic health program was to use inspection data to identify our top 3 violations that resulted in closures at public bathing places. And then translated those numbers into dollars to demonstrate how much operators were losing in closure fees, because sadly, sometimes dollars speak louder than lives when you're talking to your local operators. And once we had all those numbers together, then we developed interventions to assist the operators in avoiding those types of closures. And that's what we're working on actually this year.
Great, thank you, Carla. And Serene, how do you use data in your everyday work?
Good morning. That's a really good question. As a GIS analyst, environmental health data is essential to my work. It helps me map the permits and facilities, complaints, service requests, and help our division. And it helps me create balanced workloads for our inspection districts, and also to plan efficient inspection routes. If you know where your facilities are located, and you have the road networks, you can use tools from the GIS software and platform to create efficient inspection routes and balanced inspection districts, so that we use time as the unit of measurement, so that each inspector that goes out there has been given equal workload in terms of time. Also, we use data such as populated areas where cities and communities are in relation to where our facilities are, to inform decision-making related to emergency response, to non-permitted street vending, and other environmental health policy. We'll also be looking at social determinants of health data to target messaging and outreach to communities that may not be aware of our services, such as vector control inspections, and ways to minimize vector spread illnesses. Currently, we're also looking at satellite imagery as a way to detect green pools. So that is actually very exciting to me.
Great. Serene, would you mind sharing what green pools are?
Oh, green pools, swimming pools that have turned green because they've been neglected and not maintained, are a huge source for mosquito breeding, water source for mosquito breeding. And so we will get complaints for green pools in a neighborhood, and we will send inspectors out to do a sweep of the entire neighborhood. But if we can detect green pools with satellite imagery, that really helps us to hone in on areas that may be offending. And there might be some areas that might be repeat offenders from year to year. So, that is technology. The way that we use technology to identify this helps us really address those problems.
Yeah, that sounds really amazing, Serene. Thank you. Dr. Mazingia, why do you feel data and informatics is an important sector for the environmental health workforce?
Thank you. The ultimate use of our data is to inform decisions, such as rule change or adoption or modification of policies, or identifying communities, facilities, and areas with greatest needs. As far as my focus and passion is concerned, I'm very interested in improving the quality and credibility of the data we as an agency produce, which ultimately is used to make policy decisions. For example, we use food inspection data not only to learn about the inspected facilities, but also use the inspection data to characterize individual inspector strength in areas needing improvement. We can actually use the data to identify blind spots our inspectors may have. So we can focus our trainings to individual staff as well as the whole team. Use the data to monitor the effectiveness of trainings. This is especially important for new inspectors. It can be a good indicator of whether or not the new inspector is ready to graduate from the training that is being offered. And then third utilization is another area can include, I want to make sure that our data is credible. We use data to assess our overall consistency as a program. How consistent are we as a program? In how we conduct inspection, for example, document observations, and it helps us examine our entire process for improvements. And data does that for us. Thank you.
Wow, that's definitely a great use of data to be able to use it to look at opportunities, especially around performance. Thank you, Dr. Mazingia. Carla, why do you feel data and informatics is an important sector of environmental health?
The data helps us identify environmental factors for illness and injury, and it helps us create meaningful interventions and decide whether those existing interventions are actually effective or not. In our food plan review program, we transitioned several years back from just taking in plans, reviewing them, and kind of giving a stamp on the construction to actually bringing in the applicants and talking to them about food safety all the way through the process of the plan review. There was a second part to that once we got to the final permitting inspection, if they were unable to demonstrate food safety concepts, we would stop the permitting process, bring them back in for another meeting, and then, have them, tell us how they were going to solve those problems. And after several years of doing this, we found out actually that facilities started doing better, avoiding downgrades and whatnot after they got permitted. But we found out that the real reason behind that wasn't because of that second meeting we had, but because we were talking to them all the way through the process about food safety. And that we were able to do just by looking at the data on the facilities that had that second meeting versus the ones that just went through the regular program.
Wow, that's another great use. Thank you, Carla. And Serene, why do you feel data and informatics is an important sector?
So yeah, data and informatics is really an essential sector for the environmental health workforce. as it provides crucial insights into the complex relationships between the environment, health, and human behavior. I guess I'm repeating what Carla has already said, but environmental health data can really help us identify environmental health hazards, assess exposure levels, and inform interventions to reduce risks. Moreover, informatics provides tools to analyze and manage large amounts of data efficiently, and that's crucial for effective decision-making and resource allocation. And also, because people learn and receive information better by seeing them visualized in charts and maps than in tables, the data visualization aspect of informatics makes a big difference in helping people like decision makers really understand the data, the trends, and the seasonal patterns.
Absolutely. Thank you, Serene. Dr. Mazangia, what positive impacts or contributions have you made or hope to make in data and informatics?
Positive contributions, good question. I would like to contribute how we quality control our work to ensure the quality and credibility of our data is high and tested, because our data is used to make decisions. The impact of policy changes or other decisions depend on the accuracy of our data. If our data isn't accurate or consistent or not collected, then whatever decision that comes out of the data will have minimal impact, or even worse, waste resources. So my contribution would be more to focus inward. Thank you.
Great. Thank you, Dr. Mazangia. Carla, what positive impacts or contributions do you hope to make?
I'm hoping to normalize the use of EH data in decision-making and prioritization of EH activities. Right now, informaticians are primarily focused on working with epidemiologists on disease surveillance. We have a few EH staff who are very good informaticians, but not enough of them to really help us use and publish the data we collect. And our EH leadership isn't generally fluent in how to use data to make decisions, because they're generally focused on getting the day-to-day work done. So we kind of need to close that gap between EH staff and informatics staff and engage our leadership in order to fully utilize our data.
Great. Thank you so much, Carla. And Serene, what positive impacts or contributions have you made or hope to make?
I hope to continue developing innovative solutions to the environmental health challenges by using the data and informatics tools effectively. Back to Tim's point earlier, a challenge that our leaders have is to be able to demonstrate the impact that preventive actions have on the community. And I would like to find ways to measure and show such impacts. I'd also like to use my skills to help investigate when foodborne illnesses and outbreaks happen.
Yeah, that would be really great to be able to measure the impacts from preventative measures. I agree.
Yeah.
All right, Dr. Mazangia, what do you wish for environmental health students to take away from this online seminar today?
Thank you, Nicole. The future of environmental public health really depends on our ability to tell our story. The most powerful way to tell our story is through data. All of us create and use data on a day-to-day basis. Therefore, be passionate about the quality and relevance of the data you collect. Ask why you are collecting the data. Ask what is missing. This is very important because it is a surrogate for who is missing in the data. How are you quality controlling the data that you are generating and making available, and how it is stored so that it can be used for future students. But be curious and be involved as much as you can.
I agree. Thank you so much. And Carla, what do you wish for environmental health students to take away from the seminar today?
Yeah, kind of along the lines of what Iyab was just talking about. The data really does help us tell our stories, and public health funding is always tight and it's going to get tighter. And the data really helps us illustrate the need for funding to identify and intervene in factors that cause illness and injury. It's not enough just to say someone's going to get hurt from this. You actually need to be able to show how many people have been hurt and the societal and financial costs in order to get the support and policies you needed to mitigate it.
Agreed. Thank you, Carla. And Serene, what do you wish for environmental health students to take away from the seminar today?
I hope that environmental health students take away from this the importance of data and informatics in their future careers. I'd like them to see how data can really inform decision-making, drive policy changes, and help prevent environmental health hazards. And I'd really like to inspire them to embrace the technology. This technology is growing, it's changing all the time, and you are at a point where you are learning it. So many things are coming our way, and so many changes are happening. So definitely embrace the technology, dive right in, and continue to develop innovative solutions to all the complex challenges that we face.
Agreed. Thank you so much. And to our audience, we are ready to take questions. Please drop any questions that you may have into the Q&A box. All right, looks like we have a question here. What do you suggest students do to strengthen their competency in data? And I'll go to Serene.
Okay. I'd say that if you have an area that you're curious about, and definitely take some initiative and do some online courses. I also, like Tim, use YouTube a lot. That's how I learned a lot of the leading edge technology in the field. So be curious, take initiative, request for a workshop, or request for a course, within your program. And maybe, that can be arranged with your program director, with your professors.
Great, thank you, Serene. And Carla, would you like to answer that as well? What are your suggestions for students to do? What should they do to strengthen their competency in data?
So one of the things I would suggest is, go on the web, go to different health jurisdictions and see how they're using their data. A lot of us have public-facing dashboards where, all the data is up there, whether it's, how many people are smoking in your neighborhood versus how many wells you have. We have a dashboard called Healthy Southern Nevada. And if you go on there, it's overlaid with all kinds of national data as well as our local data. And I think it's a good way. It's good just to see how the data is used.
Great, thank you, Carla. And Dr. Mazanguia, what do you suggest students do to strengthen their competency?
Reach out as much as possible. There are many people out in the field that are willing and excited to share their many years of expertise with you. It really requires that you show interest. And then, like Tim said, practice, and that would help.
Great, thank you. Any more questions for our panelists today? Please use the Q&A box at the bottom of your screen to drop any questions that you might have. Give it another moment. All right, looks like we don't have any other questions. Actually, we just got another question in. How do you stay on track with a project when you have so much data? And who would like to take that question? Carla, Serene, Dr. Mazanguia, how do you stay on track with a project when you have so much data to consider?
I'll take a stab at it. I think the first thing is to really establish the parameters of the type of data you want to collect. Like, you don't want to collect you don't want to have so much data that you can't actually work with it. So I think being really specific and establishing your parameters helps you focus and really focus on what's important on the project so that you can see it through. Yeah,
I can help also. what Carla said was really good, but also you can work with your teams, your subject matter experts, to really decide and hone in on exactly what sort of data you need to solve the problem that you're trying to solve. So yeah, there is a lot of data out there, but it may not always be everything that you need. So try to work in collaboration with the subject matter experts.
Great, thank you. Any other questions for our panelists today? All right. Well, thank you, Dr. Mazangia, Carla, and Serene for participating in the panel discussion today. Your insight and knowledge around data and informatics is amazing, so thank you so much. All right, we will move on. So this year, NIAHA is hosting our 86th annual educational conference in New Orleans, Louisiana, July 31st through August 3rd. The theme is Raise Your Voice of Your Environmental Health Workforce. Early bird registration is still open. The AEC provides a unique opportunity to network with hundreds of environmental health professionals and those just beginning their careers in environmental health. You can receive more details at niha.org/AEC. And let me share that this year, our AEC keynote speakers will include Dr. Maureen Lichtfield. She's a dean and professor for the School of Public Health at Jonas Salk, and retired Lieutenant General Russell Honore, who held the role of commander of the Joint Task Force for Hurricane Katrina. I would like to thank our speaker today, Tim Callahan, and our panelists, Carla Shoup, Dr. Iyab Mazangia, and Serene Ong, for partnering with NIAHA and providing great content to all of our attendees. And thank you to all of you for attending today's seminar on using data and informatics in environmental public health. Please complete the evaluation for today's seminar. You will receive a link to the survey after the seminar ends, and we would greatly appreciate your feedback, comments, and recommendations. Please feel free to contact us anytime by visiting the website or by emailing us at support@niha.org. We appreciate your time today. Thank you again, and we hope you enjoy the rest of your day. Thank you.